This recording is going to talk about the phases of healing. So this is to match into your journal on the phases of healing section. So it's a big chart. You'll see the chart has 4 different columns. The first column says the stage, second column says time frames, third column says physiological effects, and then there's a section for therapy ideas. So when we look at this, we're going to look at the fact that all of the different phases of healing occur in a continuum. And I want to make this vitally clear, is that no individual is exactly like the book says. Everything is fluctuating. It can depend on the tissue that's healed, how big of an injury, how far away it is from the heart, what's the blood supply to that tissue. It can depend on the age of the patient, the nutrition of the patient, how well the patient is doing compliance-wise, what other medical conditions they have. All of this affects how well someone heals and how the normal stages fluctuate. So it can compress it and make it really short, or it can lengthen it and make it really long. So although we're giving a generalized idea, and we're going to give you some numbers that are related to those generalized ideas, it's important to remember that no one fits the mold perfectly. That being said, let's talk about the inflammation phase. So first off, when we look at time frame, we're going to see that vasoconstriction is going to occur within the inflammatory phase time frame. And that occurs within the first 5 to 15 minutes. Hopefully, given pathology and some modalities, and a little bit even in this class, you're going to see how different factors could affect that. Medications could slow down the clot time to make it take longer to clot. Or a patient might have a condition where they clot too quickly, so that time frame will be even quicker than 5 minutes. So already we're seeing some changes. Then after that vasoconstriction, we're going to see that the true inflammatory phase is going to really make its peak amount of signs and symptoms, and the peak amount of activity is going to be between 24 and 48 hours. Now, the actual start of the immune inflammatory cycle starts at approximately 1 hour after injury, but we'll see that peak at 24 to 48 hours. That's when they're going to get really hot and really swollen and all of those peak signs and symptoms. And it's related to immune function, which we'll talk about in a minute. Now, we know that we're going to get a bunch of our white blood cells in there to kind of clean up the mess that has occurred. So this debris, all this excess gunk, all the dead cells in there is going to slowly be taken away. And we would expect the debris to be gone within 4 to 6 days if someone is healing normally, and given all the other factors that we could see with relationship to this as being a healthy individual, a good nutrient rich body, close enough to the heart, getting good blood flow, all of that type of stuff. And that hopefully we should see completion time of these physiological effects that we see with the signs and symptoms related to inflammation should be gone at the 2 to 4 week mark. Now, that would be ideal. Maybe it's gone even less. It's a very small cut. We might see it's gone. All these signs and symptoms of inflammation are gone at the 4 to 6 day mark. But if it's a little bit bigger injury, we see that it's going to take a couple weeks. And I think your book even mentioned something for you to consider, that the debris should be gone and the wound should be healed, and we should move out of that inflammatory phase at 6 days pending no aggravation. Now, the last time I checked, I can't put my back in a sling and avoid using it for 2 weeks or even for 6 days to not use your back at all. Last time I checked, this isn't possible. Like, even if you were to lay in bed, you'd have to roll over, and that uses your back. So we can't rest our body part and avoid re-aggravation in a lot of circumstances. So this can complicate matters. Now, if we go back up to the time frame or to the physiological effect column, we're going to see that vasoconstriction and platelet congregation occur in that initial 5 to 15 minutes. But before we put in the stuff in blue, we're going to add to that the platelets release growth factors. These are platelet-derived growth factors, PDGF, platelet-derived growth factors. And that is going to kind of jumpstart the inflammatory cycle and really bring everything to start and ramp it up. And then we're going to see that vasodilation, that increased capillary permeability, that is going to allow for increased nutrients into the area so that we can facilitate healing. And that's done through the release of histamine. So histamine is going to get into this area and create that vasodilation and that capillary permeability. And that swelling is going to be responsible for the heat and the redness that we see, all that blood rushing to the area, that are signs and symptoms of inflammation. From there, we're going to see that the debris is gone because of phagocytosis. So this is eating of the debris or wound cleaning. And we'll see that that is done by our two major phagocytotic cells, our neutrophils, which arrive at 24 hours, and our macrophages, which arrive at approximately 48 hours. Oh my goodness, do you see how that matches up to our 24 to 48 hours where we see the immune system ramp up and the inflammatory phase get really intense in its reaction? So now that we've hit that section, I'm going to give you a moment to pause here, and you're going to brainstorm what generalized treatments would be good for this phase. And you're going to make a list on the discussion board that's right after this post or right after this video. So I'll give you a moment to pause, make your list, and then we'll continue on, and at the end you can add to the discussion board. Now, our regeneration time frame. We'll see that the time frame can start anywhere from 3 to 5 days. So that's ideally when it starts, and can last anywhere from 15 to 20 plus. Again, dependent upon so many different things with regards to the patient's physiological status. Now, during this time, we're going to see that collagen fiber formation is occurring. Fibroblasts are active. They've been called by those macrophages. They've been called by those platelet-derived growth factors to come to the area and to begin facilitating healing. And during this time, the collagen is random due to speed. We also notice that our collagen is not our normal collagen. In fact, it's type 3 collagen, not type 1 like normal. And type 3 isn't as strong as type 1 is. So normally our skin is made up of type 1, or our tissues are made up of mostly type 1. Type 3 is not as strong. And this is going to make the wound a lot weaker, or the new collagen a lot weaker. It can be as low as 15% of its original strength at 3 to 4 weeks. That's as low. That's like our hit rock bottom. But we've seen that some of our researchers have found that epithelial cells, they measure the tensile strength at approximately 4 weeks or about 1 month out, and that's about 15%. So it's going to be dependent upon the type of healing as well. Okay. Oops, sorry, got a little too carried away. During this time, we are also going to need to see angiogenesis occur. So new blood flow occur to the area, and that's going to be important in our next phase, as well as at about day 5, the wound is going to start to shrink in size. It's called wound contraction. So at the start of this time frame, we should start to see the wounds getting smaller, and it peaks at approximately that 2-week mark, where it's going to continue to ramp up until the 2-week mark, and then hopefully continue to close at that rapid pace at that 2-week mark, and then it'll slow down at the end. So go ahead and pause here with your ideas for your regeneration or your proliferation phase. Now, once we've hit the proliferation phase, we need to start thinking about when is a patient moved into the remodeling or the maturation phase. And there are signs that they are entering that remodeling phase is adequate pain control, near normal range of motion, and a tolerance to begin strengthening. So that's how we know that the patient is progressed into the maturation phase and is not sitting in proliferation. So during this time frame, we see that it could start at day 9, but again, we're looking for those signs and symptoms. And that approximately 20 to 60 days, fibroblasts are being remodeled in this time frame. And at about 6 weeks, we could have up to a maximum of 80%. That would be amazing. If everything has been going really well and healing has been going well, we could have up to 80% at this point in time. But tensile strength could take 1 year or longer. Your book even says up to 24 months. Because during this time, our collagen and connective tissue are reorienting themselves. We are creating a balance between lysis and synthesis. And we have to keep that balance up with an appropriate amount of oxygen. This is where the angiogenesis comes into play. If we don't have enough blood supply, we don't have enough oxygen in order for the tissue to heal. And therefore, we're going to get an excessive amount of lysis without synthesis. We also need to be working on increasing tensile strength during this phase of healing. This scar does not have elastin, which is elasticity, so we need to work on tensile strength. Okay, that's it for this recording. Go ahead and brainstorm your next idea and keep it up the good work.